Hi, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. So happy to have some time with you today. It is Wednesday, July 15th, and we are continuing our YWTV episodes, and today is part of our Why Women Vote series. For those of you that have been watching us throughout this time that we've been doing YWTV, you know that we have launched this year a special series called Why Women Vote. Obviously, we have a big election coming in November, and it's not just the presidency that's the big election. There's a lot of elections elections happening, and they're all important. And the important thing is, as I always say, it's not always about party, it's about issues, and it's about your values and making sure that you're aligned with people that you're putting into office that are connected to your value systems and what's important to you. So our national YWCA USA put out a report, and they surveyed a large group of women across the country about what issues were important to them when they were voting this fall. And amongst those issues, we're talking about caring for family members and also some issues for our aging population. And so today we have two wonderful guests to join us to explore some of that conversation. So thank you so much to Assemblywoman Valerie Vainieri Huttle from District 37, who's joining us, as well as AARP New Jersey Director of Advocacy, Evelyn Liebman. And they're both will share some resources about health reform impacting our state, aging in place, and information about New Jersey's paid family leave act to help seniors and their family members to make informed decision around caregiving. So personally, I'm part of that generation that's very impacted by a lot of these issues. I'm the poster child for the sandwich generation. I have 7-year-old twins, and I care in home now since COVID for my 89-year-old mother, who's soon to be 90. So I can fully relate to much of what we're talking about today, and I know so many others can as well. And as Evelyn and I were talking before the broadcast, if you don't relate to it yet, you will at some point. These are issues that ultimately impact everybody. So with that, let's start and talk with Assemblywoman Huttle about some issues. Just to give you a little background for those of you who don't know our great Assemblywoman, she was elected to the New Jersey General Assembly in 2005, and she's now serving her 8th term representing District 37. Previously, she served as the chair for the Assembly Human Services and Assembly Homeland Security and State Preparedness Committees. And in 2020, she was appointed to the chair of the inaugural Assembly Aging and Senior Services Committee, which was wonderful to have someone who has so much experience to be chairing this new committee for the state. As the chair of this committee, she has examined the state's response to COVID-19, particularly its impact on long-term care industry. She's dedicated to advocating for the aging community and their families to ensure that all aspects for New Jersey residents are handled with dignity and respect. And we're so grateful for you to make the time to join us today on YWTV Assemblywoman. So we know you have extensive experience on the state level, and now you're entrenched in focusing on the aging needs here in New Jersey. So many people, I think, have a lot of questions about who's actually eligible for the paid family leave. Can you talk to us a little bit about those details? So I think Assemblywoman, are you able to hear me? Okay. Assemblywoman, are you
Helen?
able to... Yep.
You were starting to freeze.
Okay.
I can hear you. Can you hear me?
I hear you perfectly now. I don't know. Maybe it's me. It could be any of the cameras. The beauty of technology.
I don't know.
Some issues.
I don't know. Evelyn, did you get that freeze, or was it just me?
I think it was just you for now, but
okay. We'll try again. Thank you, Helen.
Yeah. So I don't know, were you able to hear my question with the freezing going on? So we were just wondering, could you tell us a little bit about the how family leave works, paid family leave?
Well, first of all, thank you, Helen, because I think the series that you're doing for not only women, but for families, as you said, you're part of the sandwich generation. I think many of us as parents and children of older adults, we're feeling certainly the burden of extra overwhelming responsibilities. And especially during the last 3 to 4 months, it has certainly been challenging, to say the least. Family leave, obviously, the history of it was to give caretakers the flexibility to take off from work, still get paid, and still being responsible to take care of a loved one. It has been updated, or let's say amended, a couple of times. And most recently, as of July, we are including those that need to either be in quarantine or take care of their loved ones during the COVID-19 epidemic. Obviously, I think what's important here is that family leave is not just blood-related relatives. If you are responsible for taking care of a loved one, a neighbor, someone that has no means of other caretakers, you are also allowed to do that. We have extended the weeks. Originally, when it was 12 weeks. We're up to 24 weeks, and you can take that either consecutively or you could stagger the weeks. So I think that's important for people to know. I think most importantly is I think the criteria, the eligibility is quite flexible and quite easy. You only have to work, or you only have to be employed for 20 weeks, and you have to make at least $200 a week, or a combined income of $10,000, which I would think that is an extra added help for those that want to be eligible for family leave. New Jersey has, I think, been in the forefront of this. I thank the diversity of the legislature. You know, we always say we need to have more women in elective office, but we need people in elective office that are really on the front lines of these responsibilities. And I think that's important. So I don't know how you want to leave that. Evelyn, if you want to
well, that's
add on.
Yeah, that's very helpful information. I have another question for you, Assemblywoman. So we know that New Jersey became the 10th state to pass a sick time law, a paid sick time law, and the 3rd state to adopt a model family definition, which includes that extended family. So can you tell us a little bit? Oh, well, I guess we kind of just talked about that a little bit, about how that extends into non-biological family members.
Yeah, as I said before, the individuals that are able to take family leave, either to provide for your parents, your spouse, children of any age, parents, in-laws, grandparents, grandchildren, domestic partners as well, and any other individuals that either related by blood or that you consider family members. So I think the criteria is broad, and I think it's helpful.
Yep.
And I think including chosen family, individuals who need to care for loved ones, again, you're not biologically related, such as a friend or a neighbor, I think that's an extra added benefit. And I think that it ensures that the program is very inclusive of all caregivers, regardless, because I think that's what we need. I guess the old cliche, well, it's not too old, but, it takes a village. It certainly takes a village and a community of caring individuals and caretakers to really provide the support that so many people need, and that so many people, especially during these challenging times, are in isolation.
Yeah.
And so I think it just, again, we have law books, but they are thankfully flexible to be amended to include every times.
Well, yeah, well, we're very grateful that our, legislature had the foresight to make it so flexible and broad, for sure. Ladies, I think you're both on mute. Let's see. Okay, that's better.
Okay. I just want to add the caveat with the COVID-19, because we have so many volunteer caregivers that we need to really applaud and really support.
Yeah, for sure. It definitely has added, and again, I could say personally, it's added another layer of challenges for sure, operating this way, how we have the last few months. Before we switch over to speak to Ev, I wanted to ask you, I know you established a caregiver task force, Assemblywoman. Could you talk a little bit about what the purpose of that is and your goals around it?
Of course. Again, I think we all see the obstacles as caregivers, and I believe we needed a task force so that we can get input from quite a few members that are caregivers in the community, including AARP and including other nonprofits, because I believe that there are so many opportunities as caregivers that we need to address. And so I'm hoping that the Caregivers Task Force, I was just talking this morning about the implementation of it, and I'm waiting to make sure that it's being implemented timely so that we can have a report and figure out what the needs are. And so, again, most of the that we attempt to draft, many of the pieces of legislation come from the recommendations from a task force. So what better to get the recommendations from a caregivers task force to create legislation that really is essential and that really affects them or all of us, in the right way, in the correct way. So again, the caregivers task force is to understand the obstacles and the challenges that many caregivers face. And I'm hoping that when we get those recommendations, we can put that into legislation.
Well, thank you so much for having, again, the thought to get that input, because I know for those of us that are caregivers, that's so key. So let's switch gears and bring Evelyn Liebman into the conversation. Evelyn Liebman is the AARP New Jersey Director of Advocacy, and she is developing and providing strategic leadership for AARP's advocacy efforts and campaigns, both on the state and federal level. She works with staff and volunteers to create positive social change and deliver value to AARP New Jersey's 1.3 million members. That's a big membership you've got there. She works in the areas of health reform, retirement, security, livable communities, affordable utility rates, and consumer and financial protections. Before joining AARP, Ev served as the Director of Organizing and Advocacy for New Jersey Citizens Action, which is New Jersey's largest independent citizen watchdog coalition, representing over 60,000 family members and 100 affiliated community, labor, tenant, religious, housing, senior, and civic organizations. So you're well positioned for organizing around these important issues. Thank you so much for making the time to join us today, Ev.
It's wonderful to be here, Helen, and wonderful to be here with Chairwoman Vainieri Huttle, such a strong champion for so many issues that affect our aging population and women. So thanks so much. Happy to be here.
Well, so with that, so tell us, I know that you have a huge, obviously, membership based on some of the numbers we just quoted. Can you tell us some of the information and resources that AARP offers to seniors for anyone who's, doesn't know, and someone like me who just got my envelope in the mail this year when I turned 50. So, those of us that are new members joining.
Yes, I'm absolutely so happy to, and welcome to the club of, as we say, 50 and better. This is such an important topic and such an important area of life that many of us are living in, but don't always recognize it as a community of caregivers. As you said, Helen, we were talking before about how pretty much everyone is going to be in this space. And it was our former First Lady, Rosalind Carter, who said that there are really only 4 kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. And our family caregivers are the bedrock of our system for long-term care. In New Jersey, we have about 1.1 million unpaid family caregivers, people like you, Helen, people like me, who's a long-distance caregiver for my mom, who, when you take a look at the numbers, it's pretty staggering, provide over 910 million hours of care per year, valued, if we put a price tag on that, over $14 billion a year, and that's just in New Jersey. Without our family caregivers, really our long-term care system would collapse. We know that 80% of those who do need care in New Jersey are actually able to live at home in their communities where everyone wants to be, because they have the support of their family caregivers. And New Jersey has a proud history of really being at the forefront of ensuring that we have the kinds of supports that we need as caregivers to provide that care. It was maybe 10 or 11 years ago that New Jersey became the second state in the country to enact a paid family leave insurance program, which, as our chairwoman just talked about, has been significantly expanded to recognize the real needs of our caregivers through doubling the number of weeks that are available, significantly increasing the wage replacement, and as has been so important, to really expand the definition of family to include many more blood relatives, but also that family member of choice. And that is so important for folks who may not have family. It could be someone from your church. I have a neighbor across the street who's well into her 90s who needs help from that village that we all need to be. And so this has been a particular focus of AARP. We provide a lot of resources to family caregivers about how to develop a care plan, how to find resources in your community to support you as a family caregiver, how to develop the kinds of legal checklists or supports that you may need, what are the options of care that your loved one may need and have available, as well as establishing an online community for caregivers to get the kinds of supports that we all need. Folks can get information about all of those things and more simply by going to aarp.org/caregivers. We also have phone numbers, 877-333-5885. And you can also get information in Spanish and a number of other languages through our AARP.
And Ev, just so you know, we'll add the links to our broadcast, so anyone watching can just click them and go right to your website, and we'll put some of those key phone numbers in there as well.
Wonderful. That would be great.
And if there's any other resources that either of you recommend that we share with our viewers, please let us know and we'll add them as well in the comments here.
Sure.
Well, it's wonderful to know the broad spectrum of the services and work that you're doing. So let me ask a question. How are you handling the complex diversity in planning legislative reform when aging and the sect of those of us in this aging community is so different. I mean, what our needs are different. Where we live is different. That impacts us. Our cultural backgrounds have, impact on our health. Our race has impact on our health. Tell us a little bit about the complexity of handling that from a legislative perspective.
Sure. New Jersey is home to some of the most ethnically diverse neighborhoods in our nation. Our ethnic communities include African American, Black communities, Asian American, Pacific Islander, and Hispanic Latino populations, which are growing along with our own broad population that is aging like the rest of the country. But these ethnic communities are also aging at a rapid pace. So given these changing demographics, we've been partnering with thought leaders, elected officials, and leading organizations to identify disparities that exist among our ethnic 50 plus communities, and to look for solutions to disrupt these disparities. Several years ago, we launched a campaign, really a movement called Disrupt Aging, to try and break down many of the existing stereotypes that unfortunately still exist in our state and in our country around aging. We've been, by one example, working with the chairwoman on legislation to update our own laws against discrimination to ensure that they include strong protections for our rapidly aging workforce, for example, which is actually the fastest growing workforce in New Jersey, but still face many barriers in the workplace. So that's one example of the kinds of work that we're doing. We've also done a lot of work in the area of financial security, and have identified that there are many communities of color, ethnic communities, that don't have access to the kind of retirement savings programs at work that will actually help people have the kind of security that they need and be able to retire comfortably and with dignity. And so with the help of members like our chairwoman and the legislature, we recently enacted a program to establish a public-private partnership for the more than half of New Jersey's private sector workforce that don't have a way to save at work. And that will have a particularly strong impact in our communities of color, where they already face a lot of disparities in this area.
Well, thank you for sharing that. It's wonderful to know that you're working and focusing on that issue, and I'm grateful that the Assemblywoman is working so closely with you on it. So a question for you about long-term care reform. Obviously, I know that that's an area that you both are, focused on. Can you share what that looks like in New Jersey right now?
Yeah, Helen, I just want to mention that without the support of AARP, many of the pieces of legislation that are enacted could not have been possible. Because, Evelyn, I'm not saying this because you're on, but I always say this, when we look at pieces of legislation and we have the support of AARP, it's certainly like the gold seal of approval. And as legislators, we need strong advocates and strong support. So thank you, Evelyn, for everything that you and AARP does do to protect, again, not only our seniors, but, happy birthday, 50 years old. Thankfully we are living longer, and seriously, the 50-year-old person does not consider as a senior citizen. Just to stray us for a second, when I was first elected as a freeholder back in 2000, and I would visit senior centers, they were your typical older Americans there for social support. And quite frankly, many of them were probably in their 60s and 70s. 10 years later, 15 years later, those people in their 60s and 70s, quite frankly, don't consider themselves your typical stereotypical senior citizen. Evelyn, as we spoke, age discrimination, when we look at those pieces of legislation, people in their 70s that are quite frankly capable to work, there should be no need for discrimination right now in a workplace, as we are, again, a different generation. And many of our laws evolve, and that's what we are looking at. The long-term care situation, unfortunately, has been challenged during the epidemic for many reasons. We had a joint hearing with the Veterans Committee as well. Evelyn, I don't know if you partook in that. I don't, right? There was a report, the Manat report, that was issued, I guess, in end of June, early July, end of June. And the flaws or the challenges that we have seen from the report is nothing new. They've just been exacerbated by the pandemic. But I will say this, when it comes to senior isolation, and many of our seniors that were in long-term care facilities have not seen their loved ones for maybe 3 or 4 months. Yeah. And some facilities were better than others by handling that. There were some volunteers that actually would take to FaceTime and show their loved ones. Yeah. So some were doing it right, some were not. And so I drafted a social isolation bill, which would require every long-term care center to have the capabilities technologically to make sure that seniors are connected with their loved ones during a public health emergency crisis. We can only, hopefully, if this does come back again, but not only COVID, but there are other circumstances that could prevent families from going and entering and seeing their loved ones. But I think mostly what we have to also do, and Evelyn, you would agree with me, is to protect our essential workers. When we look at our caregivers in these facilities, most of them are women, most of them are of color, most of them are minorities, and they are on the low wage paying scale. So when you're in a long-term care facility, sure, medical care obviously is primary, but secondary, your volunteers and your caregivers and your health aides, to me, and I think to Helen and to Evelyn, all of us who have loved ones, they are the most important people or support that you need. Someone to hold your hand, someone to just sit with you. Yeah. And Evelyn, as we look at the consequences of the challenges that older seniors face, and I say older, it's the social isolation piece of it. And I think that needs to be addressed. And so when you don't have someone capable of coming out into a senior center during hard times or during these times, they are basically shut in their homes with no one to care for them. And so we have to have a way or a plan to come up with something that is a little bit more nourishing to our seniors. And don't forget, many of them, I had a problem getting on Facebook today or on the app today. Many of us ask our children for help. Some of you are more technologically than others, but think about seniors. They don't have the capabilities of connecting with their loved ones through technology. And so I believe that if we can help in that regard, it's a small piece in helping, their mental needs. And I would say that, again, isolation can be fatal.
Yes.
Yes, if I could just comment and thank you again for all of your work in this area. And I just would say it is not a small piece. It is a critical piece to the quality of our long-term care system, both for those who require nursing homes, but also for those who are able to continue to live at home with home and community-based services. And just as you say, the pandemic has really revealed and exacerbated some of the systemic problems we have in our long-term care system, and the tragedy in our nursing home continue to unfold, and we absolutely there are certain things that need to be fixed right away, as you've identified, including the needs of our workforce, the needs for regular testing for both our workers and our residents in nursing homes, ensuring that there are adequate supplies of personal protective equipment. We need some more transparency and accountability in these systems. We need to inspect more. We know we already have a system that struggles with infection prevention, and so need to tackle that. But this issue of social isolation is so important. And we know that it has very significant healthcare impacts. Some of the estimates are that the impacts of social isolation cost Medicare $7 billion a year. We know through work that AARP has done with other experts that 3 out of 4 Americans identify that they're lonely. And that isolation can lead to serious medical conditions like heart conditions, dementia, and other problems. So the opportunity and, in fact, the responsibility I think we all have to keep people connected is important. Along with the work you're doing, Chairwoman, we're fighting at the federal level to ensure that the next stimulus package has money in there to ensure that our nursing homes are able to have the kind of equipment that's necessary to ensure safe and visitation. And AARP has a program ourselves as well, not just only for our members, but for anyone who needs it, called Community Connections, because sometimes just hearing a friendly voice on the other end of the line can really be helpful in these challenging times. And as you say, a lot of folks really maybe technologically challenged, but maybe just having a phone call with someone and a volunteer can really make the difference in someone's day. I know for myself, with my own mom in a memory care unit, we have yet to be able to visit. And the ability to connect, at least virtually, now has been so important, and we want to make sure that everyone has that opportunity, and that's why we're looking for funding and why we're working with the chairwoman to move this legislation. But if there is anyone out there who is either looking to volunteer in our Community Connections and Friendly Voice program, or really just could use a phone call, we can be reached at 1-888-281-0145.
And we'll include that number in the broadcast so that anyone who can volunteer their time or might be in need of a call can access it easily.
Terrific. Thanks, Helen.
Yeah, and I have to say, it's so, again, I'm living some of this, so I can just tell you, and I'm grateful to have both of you on the front lines working on behalf, of our aging population. And, these are all so important. I have to say my, so many of the seniors even that are maybe a little bit more active rely on the senior centers, stop in for some of that social contact. And obviously those haven't been open But I just want to share too, as a resource, the YWCA has been partnering with the Bergen County Senior Services area and the Community Chest of Englewood. And now we are offering fitness classes for free for Bergen County seniors. You just have to go to our Facebook page under wellness, and there's a link there. You can sign up. My mom started doing the chair yoga classes because she's not able to stand. And it's really been wonderful for her to get away from me and the family and have some own, interaction as well. So, there are resources out there. The important thing is linking with them, knowing where they are to be able to help both the, individuals using them and those of us that are in the caregiver role. So I'm so grateful to both of you for the work you're doing. I know that you're impacting so many lives. And as we shared, even if you're not in this space yet, you will be at some point. And, it's important to know that the resources are available and know where you can send people for information.
Yeah.
So with that, know that the YWCA stands with you and, are here to support. And also, for those of you watching, if there's someone in your life that you wish had heard this conversation today, they can watch it later. It will be on our Facebook page and easily accessible to, tune in at a convenient time. So please feel free to share it. And again, we will add the links so that you can get information on the programs and opportunities that our guests here have shared today. So for those of you that are going to stay connected to us later in the week, we hope you can join us this evening. We'll be having a Solidarity Circle event here on our Facebook Live. It's a wonderful opportunity for our community to come together. We are really showcasing and bringing together our youth to share some of their poetry and their pieces of art, as well as some wonderful artists in our community. It'll be co-hosted with Jeanette Curtis, who is an amazing poet and artist that's here locally in Bergen County with us. And we really are looking for this evening to be an opportunity to heal and, talk through, some of the issues that we've been dealing with civil and racial unrest in our community. We'll be showcasing many pieces from our Stand Against Racism Voices publication of local artists and activists and their fight for racial equality. So we hope you can join us for that tomorrow. And there's my boss keeps running by me. Tomorrow, we hope you can join us at 10 a.m. Senator Cory Booker will be joining us for a conversation on systemic racism and its intersectionality for Black women and women of color. And I will be joined by my counterparts from our other YWs in New Jersey, and together we will be asking him some important questions that women in our community should be, listening, to his answers for sure. And on Friday, we have Joanna Calley with us, who's a senior policy advisor for the Office of New Americans at the New Jersey Department of Human Services. And she's going to be sharing some insights for us about where things currently are standing on some important immigration issues. So stay connected to the YW. There's always something to learn, something to get educated on. As I always say, it's for us, it's not about party, it's about issues, it's about your values, it's about educating and understanding where you want to see our elected officials, supporting our country and evolving it. And I have to say, grateful that we have people in office like Assemblywoman Huttle, who is so focused on so many of the issues and values that are important to the YWCA of Northern New Jersey. And grateful that we have people like Evelyn Liebman doing her, community organizing in, this very important area. So thank you both for your time today and joining us. We thank everyone out there for your time spent with us today, and we wish everyone well. Have a great day, and hopefully we'll see you tonight for our Solidarity Circle.
Thank you, Helen. Thank you, Assemblywoman.